What's your view on psychiatric medication in general?
So there's very much a divide, I think, within the marriage and family therapy world about this. Some people feeling like, no, we need to try everything else possible first. And I'm pro medication simply because I've just, not only in my personal life, but in my clients' life, I've seen it be so beneficial. I've seen it literally, I feel like, be life-saving. I've had clients tell me they felt like it was life-saving. And all the research shows that a combination of medication management and talk therapy yields you the best results. And now, am I all about, like, let's try like least intrusive measures for, of course, right?
Drugs for everybody. No,
Right, right, exactly. Like, or highest dosage, or, I don't, like, of course not, right? Like, if ever we can, less is more, right? In my opinion, with anything, right? But especially with body dysmorphic disorder, oftentimes it's, people will be really reluctant to start medication, and often it's the stigma, right? Like, what does that say about me if I take an SSRI or an antidepressant? What is that? What if my partner would find out? Or what if, they have all these bad feelings associated with that because of whatever messages they've gotten, Whereas I view medication as no different than, your prescribed glasses that you wear, right? I mean, I always tell people that, like, if there was something wrong with your eyes, right, or your child's eyes, like if the stigma of it is really keeping them from taking that step, like, would you ever tell yourself or tell someone else or your child, like, that's just how you have to look at the world now? Like, suck it up. Like, just keep, I know it's blurry. I know it sucks. I know you can't really see anything, but, glasses, I mean, people are really going to make fun of you if you have glasses. You know what I mean? Like, no, you'd say, let's go to the optometrist. Let's get this figured out. Let's get you a prescription, right? Because that's all glasses are. And let's help you to be your best self, And so medication, what's wrong with that?
I swear that I didn't set any of that up, but you and I see eye to eye on that. In the military, I tell people I was basically a therapist. That's what I did the whole time. I am big time pro therapy. I think that the proper dose is the least amount that you can use. A lot of times people will come to me for an initial evaluation, and I always talk about therapy, and they'll decide, I want to start with therapy and not use medicines, and I always say that that's great. In fact, I always start out by just kind of lighten it up, but I believe this. I always say, I'm not a drug dealer. I don't make any more money if I give you more or less. I just want what's best for you or for your kid. And then I often use sort of medical examples like that. A previous guest talked about his own struggle with depression and suicidality, and he basically said he thinks that it's all garbage and just you have to just eat well and exercise and suck it up and pull yourself out of it. And he was a very inspiring guy. I don't want to talk down to him. It was a great episode. I really enjoyed talking to him. But if you had someone who was saying something like that, what would be your response?
I'd say, if that works for you, awesome, right? If that works for you, fantastic. That's not going to work for everybody, right? And, I know, like, my own struggle with body dysmorphic disorder, sometimes and we can get into that if we want, but sometimes you see yourself in very distorted, kind of abstract ways is kind of the best way that I can really put it. Like, if your face became an abstract painting as a reflection, when you're looking at yourself in the mirror. And I don't think any amount of exercise or eating well or sleep, granted, that's going to help. Absolutely, right? That's going to help my brain do what it's supposed to do. But prior to taking an SSRI, I didn't find that solution for me.
Sure.
And I know that's been the case for hundreds of clientele.
So let's just go ahead and get into this now. That was a beautiful intro, and rather than me try to redirect the conversation, which would make no sense, let me play the listener for a second and say this. Okay, so body dysmorphic disorder, I think I heard of that once. Isn't that when people are really skinny and they look in the mirror and they think they look fat no matter what they do? What is there really to that? So tell us as much as you wish to share about your own story. Why don't you define it for us a little bit, and then I can't wait to hear about it from your perspective.
So you're right. That's one of the ways that it might manifest in an individual. But so if I just put my teaching hat on for a moment.
Sure.
So body dysmorphic disorder is a preoccupation with either a slight or an imagined or perceived imperfection in one's appearance. And it is very, very similar to OCD, right?
Okay.
So except the intrusive thoughts are surrounded around one's appearance only. And the compulsive behaviors are all about trying to either change or manipulate or hide those things that we perceive as being deformed. Oftentimes individuals with body dysmorphia, they'll describe themselves as hideous, monstrous. So it's not just someone being like, oh, I don't look good. Oh, I don't like how my nose looks, or right? Because everybody's like that. Because oftentimes when I talk with people about my passion for working with individuals with BDD, that's the short term for it. They'll say, and I know they don't come from like a bad place or anything, but they'll say things like, well, doesn't everybody not like their appearance once in a while? And it's like, well, yeah, like everybody doesn't like their appearance once in a while. This is, imagine looking in the mirror and feeling like you are so hideous and deformed that you can't leave the house because you're afraid you're going to scare people. Because you look like that deformed figure that you saw in the scary movie, right? And then the repetitive compulsive behaviors that they could take the form of mirror checking, right? So you're constantly checking your appearance multiple times a day, sometimes for hours a day, or you're checking for imperfections on your body, right? So there could be checking like physically checking with your hands right in front of the mirror or not. There could be complete mirror avoidance and it doesn't have to be just mirrors. It could be reflective surfaces, right? Where it's like, I am not going to look at myself at all because I'm so hideous. I scare myself, right? And so some people, they see something kind of very abstract sometimes and literally deformed. Other people, it's this fear of looking that way that keeps them coming back and doing the checking. Other forms of compulsive behaviors can be obsessively changing their clothes multiple times a day, oftentimes trying to hide the area of their body that they view is deformed or defective. And most of the time, although it can be about any area of your body, typically it's skin, hair, and nose in that order.
Okay.
So, and oftentimes it's more directed at the person's face, that they'll see their face is very deformed and defective, and that their skin on their face, that there's something wrong with that, whether it be like a rash that isn't there, or that the rash is worse than it is, or acne or scars, or literally that their face is misshaped. It will be fear and obsession with their hair and having too much hair or too little hair. And then, of course, the nose, right? And this idea that there's something monstrously wrong with their nose. But again, it can be any form of the body. Very typical next area of their body is their stomach, right? But oftentimes, people will change their clothes multiple times a day as a way to try to camouflage those certain areas. So they might try to camouflage their face with like changing their hair or wearing hats or doing excessive grooming rituals, right? Where they're putting on makeup and taking off makeup and putting on more makeup and things like that. That's just a few. There's multiple. Yeah. When it gets into, then it can get into financial pieces where people are constantly seeking plastic surgery or seeking the care of a dermatologist because, again, it's usually about the skin or one of the areas of concern, or it'll be their teeth, that they are constantly worried about how their teeth look, and so they'll be going to their dentist or what's the other? Orthodontist, trying to, constantly get procedure after procedure, when these professionals then typically are the ones who then refer them on to a therapist because they're like, hey, your skin looks fine, your teeth look fine. And yet the person keeps coming back saying that there's these issues, reporting these issues, and they're like, I think this is something more psychiatric going on. But then they're oftentimes so fearful to tell anyone about their symptoms out of major fear that they'll be looked at as vain, that they'll be looked at as delusional. And so you can imagine, there was one study that looked at 75% of participants did not report their symptoms. So this was just a blind survey. They did not report their symptoms at all to their healthcare professional, and terrified of going to a therapist because they'll think, well, the therapist is just going to think that I'm crazy, and that I'm psychotic, when they're not, right? They might be having delusions, right? They might be seeing something in the mirror that's not there, but it's not due to psychosis per se. It's the BDD.
Right. So is it a chemical imbalance? Is it social media and Instagram filters drive an unrealistic perfection view? Is it all of that? Like, what's been your experience?
Well, yes, a chemical imbalance, I certainly believe. There's been 3 different studies with RCTs looking at using psychotropic medications for people with BDD, and all found it to be very, very beneficial. Okay. And usually, unfortunately, the higher dose tends to be more beneficial. Just, again, kind of very similar with OCD.
I was going to say, so of SSRIs, like Prozac and Zoloft and Lexapro and so forth.
Yep, exactly. And so, when you think about people who have OCD and maybe very, very severe OCD, they typically are going to need maybe a higher dosage and maybe more long-term therapy, more long-term exposure and response prevention treatments than someone who maybe it's a little bit more borderline or the symptoms aren't as intense.
Sure.
And oftentimes people with BDD, they wait so long to seek help because they themselves don't even know what's going on, that the intrusive thoughts, they just create this solid neural network, right, where they just truly believe that this is how they look when they don't to someone else. So I don't know if I really answered your question with that, but I do think though that, BDD has been around for as long as we can imagine. It was in the DSM-3, I believe, it was called dysmorphobia, right? Which is literally like the fear of being deformed. In ancient Greece, it was called dysmorphia, if I'm saying that correctly, which sounds like a naughty word, but that's not what I mean. So, where literally there's the story of this woman who she had her nurse constantly take her to the temple so she could pray to the gods so that they could fix how she looked, because she looked so hideous, so deformed, right? So now, do I think that social media makes it worse? Of course, right? Like anything, right? With anyone with any type of body image issues, when you're constantly seeing these ideas of perfection, of course it's going to make you question yourself and question your appearance. So yeah, I definitely don't think it helps, but I don't think it's definitely not a cause. It's BDD has been around long before that.
Sure.
What else do I want to say about that? There has been an issue within, so I belong to a lot of body dysmorphia message boards and the National BDD Foundation. It's bddfoundation.org is a wonderful, wonderful resource as well if you want to learn more about BDD. But they recently, there have been reports out about individuals who Snapchat filters, right? So they will, often that can be another compulsion, is taking numerous pictures of yourself and trying to confirm or disconfirm, do I look a certain way, right? Or do I look okay? And one of the things that professionals have noticed is that people will take these pictures of themselves using filters, and they'll go to dermatologists or plastic surgeons asking to have surgery to make them look like that.
Wow.
Yeah.
You know what else is crazy with those filters? So I'm on these dating apps because I'm single, and that's what you do in 2019, I guess. But some of these girls will have nothing but Snapchat filter photos on their dating profiles. So you're looking at them and they got a dog nose and dog ears in the one, or monkey ears in the next one, or sparkles on their cheeks in the next one, and I'm like, I don't even know what you really look like.
Yeah.
What do you think that this is attractive to me? Just whatever this facade is, these dog ears or whatever.
Sometimes I'm glad I'm married and have been off the market for a long time.
Right. I feel so bad for people.
One of the things, and I've been saying this for a lot of years, and I think that all throughout my life, whenever I've said this to women when I've been single and they've been singles, I think they think I was trying to get into their pants, but I've always been serious when I've said this, is that I actually think that women look better without makeup on, because if what you love is them with their makeup on, then you're not loving them. If that's what you're wanting to sleep with, first of all, it's usually dark, but maybe I'm too much of an Iowa Protestant. But anyway, if that's what you want, is if it's I love their heels, or I love their whatever, and I'm sure it's true. It'd be true with guys and my gay friends. Like if what you liked was how their ass looked in those jeans, it's not them, but that's a very beta male thing to say. But back when I was dating, there wasn't Instagram, and there wasn't as much filter stuff. So it's interesting because Cooper's 24, and so there's a lot of different pressures, I think, in his generation.